So Ron, how can I get off Seroquel? Do people ever get off of it? That's a very good question. Seroquel is an antipsychotic medication, also can be given as a mood stabilizer. And it depends the question of do people ever get off of it? Yes, people do. Um, but depending on what you're prescribed, like why you're prescribed Seroquel, will determine on whether or not you can get off it and stay off of it. Um, for instance, bipolar mania and things like schizophrenia may not, if you come off of it, those symptoms, will return most likely, and then you're going to need another different, treatment option. Now, to get off of it, you're going to have to taper off of it slowly. The lowest dose you can get in pill form is going to be 25 milligrams. Then, depending on if you're on extended release versus immediate release, would depend on how you would go about your taper schedule. But you would want to reduce by the lowest dose every, I would say, 4 to 6 weeks. So it's a very slow taper. However, some patients can't even tolerate that. That may be too big of a jump, especially if you go down to the lowest. Like if you're down to 50 milligrams and then you try to cut by half, that can be problematic for some people. And in that case, you would need to find a compounding pharmacy in your area, or work with a provider who has connections to different compounding pharmacies to have the medication compounded in liquid form, and then do like 10% cuts every 4 to 6 weeks. So I'm Kathy Tarleton. Hi, Kathy. My husband is suffering from steroid-induced psychosis. He got 6 months ago, and no SSR or antipsychotics seem to help him. Okay. Have you ever treated a patient with this condition? And if so, with what meds? Yeah, steroid-induced psychosis is definitely something that most of the time requires hospitalization, especially if it's severe psychosis. I have seen patients with this. I haven't treated them personally because in my practice, I work in outpatient, but when I worked inpatient as a nurse, as a registered nurse, I seen this. So I wasn't prescribing the medications. And sometimes, we'd give them an antipsychotic medication orally and it would work, something like olanzapine. Other times it wouldn't, and they would get aggressive and, of course, not be themselves. And we'd have to do injections. And oftentimes those injections included things like Haldol, Ativan, and Benadryl. And then we would do that until it cleared. Now, if this is 6 months ago and still having it, I'm guessing that it's probably not acute where, he's attacking people or being that aggressive in the psychosis. But definitely the other thing to remember here is that with medication-induced psychosis, whether it's steroids or other medications, because this can happen with other medications, I've seen it with others as well, and even like marijuana. Something is happening in the brain. We're not exactly sure, but there seems to be some damage going on there. And that takes a lot of time to heal. So focusing on, what I do is holistic. So herbals, maybe some turmeric, some ginger, if you can tolerate that, to get inflammation down. It's not going to help the psychosis, but it can help maybe some of the underlying issues that are going on. And hopefully the doctors have done some blood work to see if he has high inflammatory markers. Also looking at his MTHFR or the homocysteine marker. If that's really elevated, he may actually be needing nutrients like methylfolate, B12, and also looking at his vitamin D. Those would be like the basics, and then ruling out anything else, thyroid function or dysfunction, and different anemias, omega-3 deficiencies as well. So kind of looking at what could be the possible root causes there is the path I would take in this type of situation, and then help provide him with the nutrients that he needs, make sure that he's eating a well-rounded, healthy diet. And then you said none of the antipsychotics or SSRIs seem to help. Sometimes it requires combinations of medications to help, like maybe an antipsychotic and a mood stabilizer. Lithium can be very helpful in these situations. So maybe something like lithium and olanzapine, and as a temporary thing, and until he gets better and then is fine, and then you can start the slow taper process off, deprescribe, and see if any of the symptoms reemerge. But a lot of this is going to take time to heal the injury that's occurred from the steroids. What is the best treatment and medicine for hypomania? Well, I hate to say best treatment, right? Because it's going to depend on the person and what you can tolerate, right? So for hypomania, oftentimes mood stabilizers are first line treatment. I like to use lamotrigine as a first line treatment when I'm looking at a hypomania or bipolar 2. If the person has tried it and it hasn't worked, perhaps lithium, again, going to mood stabilizers. Others would be like Depakote. And then the rest don't really have a lot of evidence base for them, but medications like Tegretol, carbamazepine and oxcarbamazepine could also be used. And with hypomania, you have to be very careful with the SSRIs or the antidepressants. Because you can actually push someone from hypomania to mania. So that's something you have to be very cautious with. If the mood stabilizers aren't effective, then you would go to like the antipsychotics, which can be used as mood stabilizers with bipolar in those spectrums. So the newer ones like Latuda and Vraylar are going to have a less of an impact metabolically speaking because they don't have the weight gain component as a side effect. So Latuda right now is now generic. It's not branded anymore. So that's good. You can get that as a generic now. But Vraylar is still branded. So that would require some insurance steps that you would have to take to get covered, use a savings card, etc., to help with that. Then you have the older antipsychotics like Seroquel, olanzapine, Abilify, which can be very helpful, but do come with a lot of side effects. And not saying that Latuda and Vraylar don't come with side effects, because they do. It's just not the weight gain piece, which is very huge, especially with Seroquel and Zyprexa, though those two medications are very useful and very helpful in manic situations. But hypomania, that might be a little bit much to go to those quote unquote big guns, So start with the mood stabilizers, see what you can tolerate there, and then go from there. Thanks for your question, Mohammed. Elias, hello, Elias, Sondengrad. Do you know when Auvelity will be available in Europe? I do not know when it will be available. The thing about Europe, which I think is actually good, that other countries actually have a more rigorous approval for their medications, which is why a lot of things that we get here in the US, you don't get in Europe. And I think that that's a good thing because a lot of medications we find out later on, after years of people using them and being on them, that they're causing actually some damage, and sometimes more damage than good. And that's why I say you always have to weigh the risk versus benefit with using psychotropic medications, including the antidepressants like Auvelity. It's fairly new, showing a lot of promise, but we don't have any real long-term, someone taking it for years, 4 or 5 years yet. So we don't know those long-term effects. So just something to consider there. But I don't know when it'll be available, but just know that Europe is doing more rigorous studies and research to make sure it's safe for you.